This is a presentation about influenza vaccination amongst older adults. We have Ashley Mendez, Caitlin Mustard, Petmini Rai, and Sally Yu, which is me, presenting this PowerPoint. Next slide. Why is the flu vaccine so important this year? So older adults, 65 and above, they bear the greatest burden of the flu disease. So 90% of flu-related deaths occur amongst people that are 65 and older, and 50 to 70% of flu-related hospitalizations occur amongst people that are 65 and above. And then with older adults that are 85 and older, they have a higher risk of developing the flu compared to those that are 65 to 74 years old. And then lastly, when you have comorbidity with the flu and COVID-19, this can have devastating effects on this population. New York in particular, the vaccination prevalence is very diverse. So it varies between different neighborhoods, with older adults 65 and above in Flatbush, Brooklyn, having a flu vaccination prevalence of about 37%, while in Sunset Park in Brooklyn, it's 85%. And then in Greenpoint, Brooklyn, the flu vaccination prevalence is actually really, really low. And the neighborhoods that have the lowest coverage in general are the following: Williamsburg, Bushwick in Brooklyn, East Harlem in Manhattan, Jamaica in Queens, and Pelham, Throgsneck in the Bronx. So amongst the New Yorkers' older adults population in general, 70.4% of those 65 and above have received the flu vaccine, which is severely lower than the national target of 90%. In comparison, 63% of white and Hispanic New Yorkers, this population has received the influenza vaccine, which is lower than 70.4. And then with Black New Yorkers, it's only 53%, which is one of the lowest amongst all these age groups. And with in 2018, Black New Yorkers, about half of them ages 65 and older were vaccinated compared to other populations, which is 65. So sorry, you can't hear me? In 2018, only half of Black New Yorkers ages 65 and above were vaccinated. Other populations, their vaccination rate are a little bit lower than the 70.4. With the white population is 65%. Latino 67%, and Asians in general has the highest vaccination rate, which is 73%. But just to say that this is all still very low compared to the national target of 90%. Next slide. So you may be wondering why why the vaccination uptake, particularly in New York, is so low. And so here are some barriers that you may encounter as a provider. So one thing is that vaccinations are viewed as a low priority compared to other reasons why a patient is coming in for their visit, whether it's an annual visit or whatnot. So with physicians, they might not see it as the priority, whereas with patients, they might view themselves as like, well, I'm healthy, I don't really need it, and so they might not want to take the vaccine. In addition to that, most employers, if not all of them, they rarely require their employees to get vaccinated, and if they do, they don't ask for proof. So as a result, when you hit about 18, a lot of a lot of people, they don't really keep up with their vaccinations. In addition to that, there are informational barriers with both physicians and patients. Some physicians aren't aware of what immunizations adults should have, and particularly with adults that may have comorbidities or other conditions, they may need more vaccines or they may not, and they're not aware of it as well. So as a result, both parties aren't aware of what vaccinations are important to keep up with as a result. Next slide. Okay, so here are the more important barriers, I would say, I guess. So lack of accessibility. So vaccines cost money, and a lot of patients may have to pay out of pocket for vaccines. And when they see that, they may not be more willing to partake in receiving one. And in addition to that, low-income families, they may not have insurance that will cover it, or they are not aware of programs that advocate for free public health vaccination. And also with low-income families, they might have transportation issues. So it costs money to take the bus, to take the train, to drive to your doctors to get a vaccine, especially if you're living in a rural or suburban area where you might not even have public transportation. In addition to that, you have language and cultural barriers. Language barriers, the physician may not be able to educate their patient on what they need, or the patient themselves may not be aware of what they need and they can't understand what the provider is saying. Incomplete records means when a lot of patients, they might switch providers for whatever reason, or they may have an additional provider due to a health condition that they may have. And because we don't have electronic records may not sync together, or patients themselves are not aware of their immunization status, they may not be willing to receive vaccines, and providers may not be aware of what vaccines their patients already have, and as a result, they're reluctant to even give the vaccine themselves. And then lastly, one of the bigger barriers is the patient attitudes towards vaccinations. They may not trust vaccines. They're scared of side effects, especially if the vaccine is particularly new. And with older adults in particular, they might see, well, I'm getting older. Because I'm older, I'll get sick anyway, so there's no point in me getting a vaccine. So these two in particular are really, really big barriers that can prevent older adults from receiving vaccines that they may need. Next slide. And I can pass this off to Ashley.
In 2011, here in New York, a study was conducted to assess influenza vaccination uptake within an urban home-based primary care program. Within the program, Mount Sinai visiting doctors provided home care to homebound elderly ages 65 and up. Next slide, please. According to the study, flu vaccine uptake among patients was 80% compared to 75% of community dwellers of the same age and 74% of nursing home patients of that same age as well. The high vaccination coverage rate among the Mount Sinai visiting doctors cohort demonstrates that home-based primary care may be an effective way to deliver the flu vaccine to the difficult-to-reach elderly. Another contribution to high vaccination rate could be the administration of vaccinations at home without additional costs, which is a barrier that Sally mentioned earlier. And other reasons for influenza vaccine uptake could be attributed to the increased rapport between provider and patient, provider continuity, and patient-physician selection.
This is the increasing vaccination model. And I find this model extremely helpful and important in visualizing how intrinsic and extrinsic factors can affect a person's motivation to get vaccinated and follow through with that motivation. So as you can see in this model, what people's thoughts and feelings about the vaccine, such as the perceived risks and trust and safety concerns, interact with social processes such as provider recommendation, and they interact with each other to help motivation to get immunized, and practical issues such as vaccine availability, costs, service quality, and satisfaction help factor in their ability to follow through with that motivation.
So implications for practice. So as you may all be aware that the healthcare provider plays such an important role in increasing the vaccine uptake, especially amongst the older adults. Patients in general, not just older adults, they really trust what the provider says. So the provider plays a huge role in educating the patient on the benefits of the vaccine. And in particular with patients who may be at risk for vaccine preventable diseases, they can make recommendations to this population to acquire the appropriate vaccines for these particular patients. In addition to this, knowing what barriers prevents older adults from acquiring vaccines can help us understand what barriers may prevent them from acquiring the COVID-19 vaccine in the future. We all know the COVID-19 vaccine is being made currently. I believe it may be available by as early as the end of this year, but most likely the beginning of next year. And the healthcare provider will also address any concerns that their patients have in regards to COVID-19. And then on the left here is a graph of all the age population groups and which group is most affected by it in terms of mortality. So you can see from this graph that 65 and above already, that's when most of them are affected by COVID-19, and in particular those who are 85 and above, they're the ones most at risk, that are most affected and may most likely develop exacerbations in relation to COVID-19. And again, these are the statistics regarding older adults and COVID-19. So as I mentioned, older adults are at the highest risk. 8 out of 10 COVID-19 deaths has been attributed to adults that are 65 and above in the United States. And then, as I mentioned before, those 85 and above are the highest risk for developing exacerbations related to COVID-19.
So how do you talk to your patients about the flu vaccine, particularly older adult patients? Older adults see healthcare providers as an important resource for making their healthcare decisions. So many studies have shown that older adults are more likely to get the flu vaccine if it is recommended to them by their provider. It is also important to make that conversation personalized because every patient is different. Every patient comes from a different cultural background or belief system, and it is important to use that context in order to make that conversation with your patient. And it's also important to educate your patient, particularly about their susceptibility to becoming infected with influenza, because a lot of studies have shown that older adults do not perceive influenza as a serious risk in their health. And from that, it's also important to talk to them about the potentially serious consequences of influenza, such as the disease sequelae that may come from infection, and also discuss with them about any side effects and contraindications. While you are educating your patient, you can also invite questions, which is also very vital. And by inviting questions, you can assess your patient's understanding about the information you presented to them. Next slide, please. Visual aids are also an important resource when educating your patient or talking to them about the flu vaccine. Providing pamphlets or posters can help the patient read up on the flu vaccine in their own time, and additionally highlight important information that you may not have been able to provide for them, and make sure that these pamphlets are not written in small print. Standing orders are also very important. Having standing orders helps other members of the healthcare team, such as the nurse or pharmacist, assess the patient's vaccination status and administer vaccinations without a direct order from the attending provider. It also helps remind providers to speak to their patients about the flu vaccine and address any concerns. Additionally, annual reminders to patients by mail or phone can also help motivate and remind patients to get vaccinated. So healthcare providers play an important role in helping patients make their healthcare decisions. Increasing vaccine uptake among older adults is important, particularly within this upcoming flu season, as influenza comorbidity with COVID-19 can have potentially devastating effects. Implementing these vaccine uptake strategies can have future implications when it comes to the COVID-19 vaccine. And with this in mind, it is vital to recognize the factors that affect patient immunizations and initiate a conversation with your patient about the flu vaccine. And that's all we have. That's all that we have for today. I would like to thank the Bridge program for inviting us to speak. And thank you. And if you have any questions, feel free to ask them.